All right, everybody. So thank you guys so much for coming out on a Friday night. I appreciate that. So welcome, welcome, welcome. Okay, we're getting together tonight for a specific reason. I want to spend a little bit of time talking to you guys about what's going on in the Medicare space right now. If you haven't been paying attention, I mean, woo, woo, it's a lot going on right now. Okay, so what I want to do is just take a couple minutes, give you an overview. We ain't gonna keep on like Medicare and all that. You already on Medicare,
Yeah,
you know that.
really.
Okay? We're not doing all that. Okay, but what I want to do is kind of give you an overview of what is going on out there, because ever since our president came in office, there's been a lot of disruption going on in the marketplace. Okay, so I just want to make sure that all my people and everybody I care about knows what's going on out there, and put y'all in a position where you can make the best decisions possible for yourselves. Uh, some of this, we're not going to like everything we see, but the best we can do is make sure that at least we know what's going on. And that's the best I can do is just kind of help y'all. I'm going to spend a couple minutes. I got a couple of slides just because it's easier to look at stuff than me sitting here talking. And then I'm just going to make sure that I can answer whatever questions you guys have. And then, even afterwards, if you need something, can always hit me up. Okay. So let me start to share my screen. Let me know when you can see.
Yeah.
Okay, so you all see the full screen there. It says Medicare with the big blue. So we're just going to talk a little bit about Medicare today, but let me get us all up on the same page. Now, most of y'all know me, but I got to do the real thing. Okay, so y'all all know I'm Miriam's big sister. At work, I only use my maiden name because it's easier. So I actually have my own financial services agency. I'm with Experior Financial Group. I got downsized by Prudential last year in May. Boy, not the first time in my career. And so finally decided I'm tired of all that. So I'm actually doing my own financial services agency right now. I'm an executive director at Experior Financial, and I own my own agency, Harmony Financial LLC. Just so you know, my agency doesn't actually do Medicare. Now, when I was working for Prudential, I managed Medicare teams. I listened to thousands of Medicare calls. That was what my people did. So I know a lot about Medicare. Okay. And because my agency does overall financial services, I'm passionate about advancing financial literacy and making sure that people understand how money works. And I've been in the insurance space and the finance space for over a decade now. And it's super important to understand where like finance and insurance and all this stuff kind of comes together. So my agency does not personally do Medicare. Okay, so I'm not a Medicare agent, but it's important that I continue to monitor what's happening in the healthcare market because people's money is affected by what happens with their healthcare, right? And how much it costs them to manage their healthcare, and that affects the resources that are available for me to do the rest of my job. So if you're thinking like, why are we talking about Medicare and I don't actually do Medicare? That's what it's about. So part of what I do at Experior is we focus on what we're good at. And then when we're looking at people's overall wealth building strategy, sometimes we talk to you guys about your needs and then we find out that you got little holes here and there. Okay. So instead of us trying to be all things to all people, which makes you not good at anything, we have strategic partners that we align ourselves with that we can point our people towards when they need help with other stuff. Okay. So one of our strategic partners allows me to basically function in like a concierge. Okay. So think of me as the Medicare concierge. So if you went to a new city and you didn't know where to have dinner, you go down to the hotel lobby and you check in with the concierge and say, hey, where's a good place for me to go and get this or that or the other, right? They're going to point you to the right place. That's kind of what I'm here to talk to you a little bit about today. So I'm not the Medicare agent, but I know enough to know what's going on. All right. So let's just talk about Medicare in general. Okay. So the Medicare marketplace, there are 68 million Americans who rely on Medicare. Okay. And 55% of them get help for their Medicare decisions. So this information is relevant to you if you are 65 or older, or you're already on Medicare, or you're going to turn 65, but it's also relevant to people like Miriam and Tate and Ann, who help our family members with their Medicare decisions, right? So that's why I'm trying to make sure everybody knows. The strangest thing is that most people, 80% of people, don't even know who their Medicare agent is. Okay, so those of you who are on Medicare right now, if I ask you who your Medicare agent is, do you actually know who that person is? Probably not. Okay, so what happens is that people end up, getting into plans, and they just sort of keep it, and it's not always the right thing. So what's happened this year? Every year Medicare plans change, and once you're in, if you don't do anything, it just kind of rolls over in the insurance space. I personally feel that everybody should look at their plans every single year to make sure that they fit. But the truth is that most people really don't. And they don't change that much from year to year. So people just sort of let them roll over. But this year, the changes that I'm seeing in the Medicare space are the most drastic changes that I've seen in over a decade. And a lot of this is because of the big, I'm gonna say the big B bill. You can fill in the B what you think it is in the middle, okay? That had a significant impact on hundreds of millions of dollars were pulled out of the Medicare coffers in that big giant bill. Okay, part of what's going on right now with this government shutdown is that they're trying to kind of hold the line there, because Medicare is for people mostly 65 and up, and Affordable Care Act, which is Obamacare, is what I call U65, for people under 65. So part of what's going on with the shutdown right now is that all this juggling that's gone on since Trump has come into office, subsidies are getting ready to expire. So those of us under 65, we're getting ready to see ridiculous changes in our premiums that are going to force millions of people off of health care. So what's happened in the Medicare is that it's already happened. Y'all just don't know it yet. Okay, so the bill changed, they pulled the money out, and there wasn't something like a shutdown or something coming where they could kind of force the issue. So what's happened with Medicare has already happened. Y'all just haven't seen it yet because your plans haven't come for next year. So what I want to say is we need to look at the plans every year, but this year is the one year that if you don't never look again, I need you to at least look and see what's going on. Okay, so before Biden got out of office, y'all remember he was negotiating down the drug costs of insulin and, the 10 most common medications that people are on. They were negotiating those prices down. Y'all remember that was in the news, right? Okay, then Trump came in with his pen and started undoing a lot of stuff that Biden did. So some of that stuff stuck, some of it did not stick. All right. Then you got to think pharmaceutical companies, they're not running charities, right? So if they're forced to negotiate, and the insurance companies are forced to negotiate the price of all these core drugs down, do you think they're going to take that laying down? No, they got to figure out to get the money back somewhere else, right? So they're going to start affecting prices on the other drugs that weren't on the short list. Then the big B bill came through and they pulled out more money from it. So what's happened is that there's a redistribution going on inside the Medicare space right now, where normally just one or two things would change a little bit, everything is kind of got thrown up for grabs, and everything is getting redistributed. On top of that, because you have 68 million people literally trying to make a decision in a small period of time, it creates a predatory marketing environment. All right. So you should have noticed the commercials for Medicare are like popping really crazy right now, right? So commercials for Medicare are everywhere. You're getting junk mail in the mail. You're getting your phone call is your spam filter on your phone is going crazy, right? Because everybody's out there trying to get part of this Medicare dollar. There's two communities in our society that predators take advantage of: young people and seniors. Well, the young people are broke. They don't have any money. Okay. So they're coming after the seniors. So in this particular time period, this window of time, the scammers come out of the woodwork as well. And then you get agents that kind of jump in and try to get a piece of this pie that don't really do Medicare all year round. They just kind of do it in a short little window, which doesn't make them bad people, but they're not specialists. Okay. So we got all of that going on. So you seniors know, you got to look out for the scammers and stuff like that. So I'm here also to tell you, you should be protecting your Medicare, your red, white, and blue card. You need to protect the information on that card almost harder than you do your Social Security number. Because with that Medicare number, a scammer can wreak havoc on you. Okay. So just know that you're in an environment, you're in a window right now where there's a lot of bad players out there. That's the nicest thing I can say about that. Okay. So we got that. Then I want you to think about the fact that each of you that are already on Medicare, you should have gotten what's called an annual notice of change. So you got the big book from the government that said Medicare 2026, right, with the white cover and the, y'all saw that, right? It's about this thick, 150 pages, right? And then whichever carrier you're already with, United Healthcare, Aetna, Humana, they should have sent you out another little book too. Okay. And with that book, by law, because it's a government program, they have to tell you what the changes are that are coming up. It's a government regulated program. They have to. Okay. But that doesn't mean they have to actually help you. Okay. So it's kind of like, what's the joke? I'm from the government. I'm here to help. Right. So when they send out that annual notice of change, it's not designed to really help you make a good decision on what's happening. It's kind of designed to set up to say, okay, they're fulfilling their regulatory requirement. They're telling you what the changes are, but it's in a format that most people look at it, whether you're the actual senior or the person helping the senior. You look at it, you go through a few pages, you get overwhelmed, and you're like, you know what? I'm just going to leave it like it is. It ain't broke. I ain't messing with it. The insurance company is putting information out in a way to kind of hope that you get overwhelmed. So you just stay with them and you don't look around and you don't shop your plans around and you just absorb whatever changes that they push through and you get stuck with it. So let's talk about what Medicare is and what it isn't. Okay. There's 4 parts in Medicare. We ain't gonna go a whole lot deeper than this. Okay. So when you turn 65 or you got a special situation, you got 3 months before your birthday and after your birthday to get signed up for Medicare, unless you're covered under other insurance, like through a job or something like that. If you don't do it in that window, when you finally do sign up for Medicare, you're going to pay a penalty that's going to stay with you for the rest of your life. The penalty is 10% of the cost of Part B. So Medicare Part A happens automatically. People think it's free, but it ain't really free because you worked your entire life to earn the right to be on Medicare. You worked all those quarters for your Social Security, right? The 40 quarters or whatever. So that part, there's no cost. You turn 65, you get enrolled. Then you have to actively enroll in Medicare Part B. If you don't do it in the window, not good. So original Medicare is Part A and B. Then there's Part C and D. Okay, so Part D is the prescription part. If you don't sign up for a prescription plan, you don't got no prescription insurance. So when you go to the pharmacy, it costs what it costs. Okay. And then Part C is what we call Medicare Advantage, which is like a bundle that kind of takes A and B and D and puts them all together with some other stuff. Okay. So original Medicare is A. You have to sign up for B. Okay. The cost of Medicare Part B, usually you guys opt to have whatever that cost is deducted out of your Social Security allowance every month before they send the money to you. So for example, I think Medicare Part B last year was around $185. And y'all, that sound about right? $175, $185 last year. This year it went up to $227. For 2026, I hate to be the bad news person, but it's going to go up. Okay. So we have that. And then Medicare Advantage kind of combines all these together. Now, here's the thing. Most of you guys, when you start on Medicare, the original time that they get on Medicare and what you choose, whether you do the original Medicare or you do Medicare Advantage or you decide to do a Medicare supplement, I know, because I'm in this space, is that most of you guys aren't making that original recommendation based on somebody coming in and really looking at exactly what you need. You get a mailing from AARP, right? Or an agent calls you on the phone, or a family member says, hey, I got this one, it looks good, you give it a try. So whatever people get on in the beginning, they just sort of stay on it, but it's not always because it's actually the best fit. It's just sort of what they started out with. And then when that thing comes in the mail the next year, it's overwhelming and they just stay put. That's what happens for real. But does that mean that you're actually getting everything you're entitled to? Maybe, maybe not. All right. So what we want to do is make sure that your Medicare, and this is important because it affects your life every day, right? You go to the doctor, the quality of life. So your medical suite should include, besides the hospital and stuff like that, elements of, rides to the doctor, do we have dental? Do we have vision? The silver sneakers. So these are the kinds of things that if you have the right Medicare plan, these are additional benefits that can be included in your plan that affect your cash flow and your quality of life and what it is that you can or cannot do. Okay, so all of these elements are going to play into the quality of life and the quality of your care. So when you're trying to decide what you're going to do about your Medicare, because you've got to do something, right? You can't not do it. How do you figure out what's going to be the best thing to work? So there's two different ways. You can go with the carrier. You can talk to the carrier. So like right now, my husband's on Medicare. He has United Healthcare. That's when we picked him last year. Okay. He's on United Healthcare. So when we're trying to decide what he wants to do for his Medicare, we could call United Healthcare and say, hey, what you got? Well, what do you think United Healthcare is going to show us? The United Healthcare options, right? They're not going to show me any other options, but they're going to show me what's available for United Healthcare. So there's that. There's a built-in bias there. Then you may have, maybe you're one of the 20% of people that actually does know who your agent is, right? So maybe the agent, maybe you call the agent and say, hey, Leah, you're my agent. What should I do this year? Okay. I would make that recommendation based on the products, the carriers that I represent, that I can offer you. But every Medicare agent has to get certified and appointed with every single carrier that they represent in every zip code that they want to represent. So depending on the budget of that agent, they may choose to represent one or two carriers over a wide space, or a bunch of carriers in a narrow space, or they may have favorites. But they're only going to look for you at what they're going to get paid on, because they're trying to run their house too, right? You can't be mad at them. Right. So what you really want is you want a broker. Okay. You want to be working with a licensed broker. So what a broker can do is the broker has the ability to look at multiple carriers across multiple zip codes and all the options. Okay. So the way I want you to think about it is, if you had a medical procedure coming up, like my husband, we're going to have to do his knee. Okay. You got a medical procedure coming up. The doctor says, hey, Miriam, we really got to go in there and take care of this thing. And you're like, I don't know if I really want to do that. Right. So if you decide you're going to go get a second opinion on a medical space, would you get the second opinion from the same doctor that gave you the first opinion? No, that doesn't make any sense, right? That's the way I want you to think about your Medicare. If you're trying to decide whether you're on the best plan and you're getting everything that you're entitled to, do you go back to the place where you're already at, where they're only going to look there, or are you going to go to somebody who can look at everything? That's what a broker can do for you. Okay. And then the other thing that we have to be careful, again, just like the individual agent who's only going to show you what they got and what they get paid for, we want to find a broker that's going to make an unbiased recommendation that doesn't get paid based on a commission, which is almost impossible to have. Okay. So I told you that we partner with different partners at Experior. So we've got an alliance with a broker who pays their Medicare agents to stay on salary all year round. And they get paid exactly the same, no matter what solution, no matter which one you pick. They pay them $85,000, $90,000 a year. And all they want to do is go home to their families at the end of the day. Okay. So no matter what you choose, they have no bias in it. and the system that's used in the back to sort the policies out doesn't have a bias built in based on which carrier pays higher. This is really unheard of in industry. So EOS is really different. So that's the, as the concierge, this is the recommendation that I'm trying to bring in front of you. So this is a free resource that's going to give us access to options that, in an unbiased way, that's going to let you figure out whether you're in the right space. So let's really quickly just look at a couple of facts, okay? Because I know a bunch of y'all think in the back of your mind, I don't like changing stuff. Nobody likes change, okay? I mean, who likes change? Any of y'all like change? I don't like change, okay? And as we get more mature, we like change even less. So I know I'm sitting there asking you to think about doing something that you ain't even trying to be doing. So let's just be for real with that, okay? But as your family member, I actually know what's going on, and it would be really irresponsible for me to just let y'all be out there and don't tell you what's happening. You can do whatever you want, but I got to let you know. Okay. So what's happening here is that 98% of you guys are getting emails, you're getting blasted right now with a whole bunch of stuff. Okay. The average couple is going to spend $300,000 on healthcare. All right. Almost half of you guys are not in the right plan. You're in a plan, but maybe not the best plan. All right. So what we want, there's over every zip code in the United States has a different combination of Medicare plans that are available by that zip code. So a plan that may be available in my zip code here in Newcastle, Delaware, may not be available 15 miles away over in Wilmington. So for you to be able to see what's happening, we got to make sure we cover all the ones, okay? So there's a couple of times that we got to pay attention to here, all right? So again, you got that window around your 65th birthday to sign up, all right? Then where we are right now is what's called annual enrollment period, October 15th to December 7th. That's when 68 million people are trying to make that decision. For those of us under 65, it's the same equivalent as open enrollment for Affordable Care Act, which happens to start on November 1st, by the way. Okay, which is why they're fighting over there in Washington right now, you know, because it's coming up on us fast. So we're in the annual enrollment period from October 15th to December 7th. What happens during this window is that if you've got Medicare Part A and B, minimum to get started out with, you can make a decision to make a change in your plan. Okay, so maybe something that, like last year, my husband didn't need a knee replacement last year. Now we do. So we got to have a plan with a good orthopedist and a good physical therapist and all that kind of stuff. Maybe last year you didn't need hearing aids and this year you do. Maybe you haven't gotten new dentures in 5 years and you need new dentures this year coming up. Okay, so things change from year to year. So when you're in this window from October 15th to December 7th, that's when you're being blasted with all of this junk mail and all these people who are trying to get you to come to them to buy the plan. You can literally change your mind as many times as you want in this window. So if you see something today you like, you can sign up for it, and then some dude comes, knocks on your door in 3 weeks, and he tells you something that sounds good to you, you could flip over to what he gives you, okay? Medicare does not allow you to be enrolled in two things at the same time. So if you change to the second one, it automatically takes you out of the first one, okay? The only one that counts is the last one that's there on December the 7th. But none of those plans are going to start until January 1st of 2026. So say we go in there, I'm going to show you how to do it. You find something that you think is going to work for you and say, oh, this is better than the other one I had last year. Yeah, okay. We sign you up for it. Doesn't cost you anything. Doesn't cost you anything. Then you go in January to the doctor, and then you find out this plan sucks. Okay, I don't like this plan that I picked. What most seniors don't know is that you get one more chance to change your mind. It's called open enrollment period from January 1st to March 31st. So in that window, you can't flip-flop and keep changing your mind, but you can make one more swap. Okay, so anything you do in this window now, you can fix it one time between January 1st and March 31st. But once March 31st rolls around, you are locked in and you are stuck with whatever you're in for the rest of the year, unless there's literally an act of God. It's called special enrollment period. So you moved, so your zip code is different. You had a hurricane, a tornado, spouse passed away, some special situation. Whatever happens on March 31st, you're locked in, you're stuck for the rest of the year. So annual enrollment period is where we are now. You can look at stuff around and change your mind a couple of times, as long as whatever's locked in on the 7th is there. But then you do get one more chance in January to make one more change if you need to. Okay? So I'm going to pause here for a second, because I've been talking about a lot of stuff, and I want to make sure we're all on the same page. Does anybody have any questions about the time that we're at, or like why we're talking about? Then I'm going to introduce EOS. I'm going to introduce you to the referral partner that I'm recommending to help you make this decision. But I want to make sure that we're all kind of on the same page. Do you have any questions so far?
Oops, okay, so my broker set up my account. I'm like 66, so I got in at 65, and he set it up, and it was because I had no health problems. You know, I'm still in good health and stuff like that. So he set it up. You know, I got gym benefits and stuff like that for free, and really nothing's changed. So I'm looking at the annual notice from my Molina, my healthcare company. It looked like, you know, some things have got a little bit more expensive, but if I don't see anything outrageous, don't change it.
Well, that's what we're here to talk about. So sounds like he put you in a Medicare Advantage plan because you don't have like uncontrolled diabetes or heart failure or something crazy like that, right? Where you need specialists and stuff all the time. So the Medicare Advantage plans are very powerful, where they do have the over-the-counter benefits, silver sneakers, the gym memberships, because it's health and wellness. Okay, so he put you in a Medicare Advantage plan. True. Okay, so that was not a hard decision to make at that time. Okay, so what I'm recommending is that what you guys usually do, and this isn't like your second year doing it, is every year those changes planned. So everything that's paid for this year under that plan in the amount may or may not be covered next year. So you've been flipping through that book trying to see the changes, right? But that book, I'm sure just for that provider is about 35 or 40 pages, right?
Yeah, about so, yeah.
Yep. Okay, so I'm sure you're a smart man, but kind of sorting all that stuff out, you don't really know everything that's happening underneath there. You're just kind of looking at the highlights, right?
Correct.
Exactly. Hey, I know, bro. Okay, so what I'm saying is that what we want to do is we want to look every single year and make sure that what was covered last year is still covered this year. And that all those little prices and stuff that are going up. So say, for example, if the cost of you seeing a specialist last year was going to be, say, $30 copay when you go to the doctor, right? And then that goes up to $45 this year. If you only went to a specialist one time last year, that didn't really make much difference, right? But now maybe this year you actually got to go to a specialist like 6 or 7 times. So now 45 times 7, okay? You see what I'm saying? And then the drug that used to cost, right? So the drug that used to cost, let's use my husband for example. The drugs are like tier 1, tier 2, tier 3, right? Your generic stuff is usually like no copay, 0 copay, very, very low, right? You get to the specialty drugs, they start costing more. So tier 3 drugs right now are covered under Medicare at a flat copay amount. So my husband pays $47 for his Farxiga because it's tier 3, brand name, but he needs it. Okay. Next year, if we stay on that same plan, all the Medicare, all the insurance providers have moved to a percentage. So tier 3 drugs are now going to be anywhere from 15 to 21% of the retail price. So for Farxiga, it runs $725 a month. So now instead of Steve paying $47 a month for his Farxiga, if he stays on the health plan he had last year, it's going to cost 15% of $725. You do the math on that, it's $108 a month. That's one drug. So like I told you, some of the drugs went down, the insulin and the lisinopril and the atorvastatin, but they're making up the money in other spots. So we call that the formulary. The formulary moves every single year. And that book that they sent you kind of scratches the surface, but you don't really know exactly what it's really going to cost you. Okay, so I'm trying to point you towards a resource that's unbiased, that's not going to cost you anything, that actually sorts all that stuff out for you in the background in about 2 minutes instead of you spending 3 weeks with a bunch of spreadsheets trying to figure out what the change is. And it's going to let you look at every option that is available in your zip code this year. And worst case scenario is you go through the whole thing and you find out the one you own is still the best one. Okay. And this is the only resource that I know, because remember, I told you they get really good salary. If the plan you're in is the best plan, they will tell you, Anthony, you good. Don't do nothing. Stay right where you're at. And that's what you want. Somebody to tell you if where you are is the best place. Now, I've seen what's coming down, and I'm going to guarantee you right now, ain't none of y'all going to like what you see. Prices are going up across the board everywhere. But at least if you get stuck in the same plan next year, when you go into that pharmacy and you got to pay that new price, you won't be thinking, ooh, I wish I had looked. Is this the best I could have done? That's why we're here. I'm just trying to get you to look. Okay. So if where you are is good, then stay where you are. If you need to change, then we can help you make the change. And at EOS, I like to call them the Medicare easy button. Okay. When it's done properly, what we do is you need your red, white, and blue card, right? The list of your current medications and their dosages, your favorite doctors and specialists, and which pharmacies you like, and hopefully know which plan you're on. Okay. When this is done right, and I'll show you how to do it. If you have to change, if you tell it, if you get to keep all the same doctors that you had before, all of the medications that you need are covered at a price that you can afford, you don't have to change your pharmacy. The only thing you might change is the card in your wallet. Is that really a change? If you go to the same doctor and you use the same pharmacy and all your prescriptions are covered and you don't have to spend so much money you had to swap out your groceries, and all you got to change is the card in your wallet? I know we don't like change, but is that really a change? It's not, because guess what? Even if you stay on the same plan, they're sending you a new card anyway. You got to swap that bad boy out anyway. So do you care if the card says United Healthcare or Humana or Aetna, if you still get to do everything else the same way you were doing it before? Are y'all following me? I'm trying to set you up in a position where at least you know what's going on. Okay, and this service is absolutely free. So the agents are on salary. They don't care what you pick, but they're specialists. They're not part-time Medicare agents. They don't do it 4 months out of the year and then run over and sell life insurance the rest of the time. And if you have questions, they can answer your questions. Like Anthony, you're healthy, right? So
but I still want the number.
You know, yeah, that's what you want, the number, right? Say you have a situation where, say like say you have somebody that has diabetes, right? Right? Everybody got diabetes. Okay. So if you got diabetes and it's under control, it's not a big deal. If you have diabetes and they're having trouble managing it, maybe the Medicare Advantage plans may not be the best ones for you. Maybe you need a Medicare supplement plan. Well, the people at EOS, they can look at original Medicare, they can look at Medicare Sup, and they can look at Medicare Advantage. So if you have any questions, it's like that, what's that game where you get to phone a friend? You phone a friend, the friend is the guy at EOS, and they're going to actually talk you through, answer your questions, They're trained to work with seniors and be patient and be respectful and not be trying to rush you through and shove you off the phone fast and all that kind of stuff. Okay? So that's really what we're talking about here.
Is this making sense to you so far?
Yeah, but I want to ask her a question. I got United Health, right?
Uh-huh.
I got United Health.
Yep.
And do I need to call them and see how my plan is? I can do that. It's the same.
Well, what I'm recommending, remember earlier I said if you were going to get a second opinion, would you go to the same doctor? The answer is no, right? So if you go to United Healthcare and ask them if United Healthcare is the best plan, what do you think they're going to show you? United Healthcare. They're not going to show you nothing else. They'll get you another good United Healthcare plan, but what if there's another plan in your area that actually you get better benefits on? That's what we want to just double check. Okay. Okay. So I'm going to show you how to check and see all of them. And if the one you're on right now is actually still the best one, it will actually tell you you are on the best one. Don't change.
Yeah. So you go show them too.
I'm going to show y'all how to do it.
Yeah, that's the next step she's about to show you. Of course, you can always ask them, Marie, but what's going to happen is they're only going to tell you about the one you got.
Yeah, actually, let me stop this video. Okay, let me go straight over
where you can compare them all.
Okay.
All right, so there's a couple ways to get onto the website. Okay, you can hold up your phone to the screen right now and scan that QR code. Okay, it'll take you straight over there.
It would probably, Leah, be better if you were to copy and paste the link into the chat.
Yes, that's what I'm trying to do right now. Hold on, I'm trying to find the chat thing so I can drop the link. Yeah, well, and there's a phone number too. So if you want to just call, because some people don't like doing the computer part, right? If you want to call, you can just call. I was hoping it was going to let me know.
833.
This is the link that takes you straight to the, and you want to do it anyway on your computer because you don't want to be trying to look at it on the phone. It's too small.
The stuff that's on the screen right now, she's going to also send it to you in a link that she can click when you guys get off to kind of, that will take you to the site.
I'm going to stop sharing for a minute because I'm actually going to click into that link.
Okay.
And then show you what happens when you go over there. All right, now I'm going to reshare my screen. So when you click that link in that I just dropped in the chat, it's going to bring you to this page. Okay. So did everybody get to the link in the chat? So at least copy it or something. It's going to bring you to this page. So you click the link or follow the QR code, doesn't matter which one. Okay, it's going to bring you to this page. So there's a couple things you can do. You know, here's the phone number. There's a couple different phone numbers. It kind of explains everything I just told you.
So hold on, Leah. Just watch.
Okay, breaking that down.
She's giving you a demonstration. You guys don't have to do it right now, but she's showing you that when Ann does this for you guys afterwards, this is what the page is going to look like.
If you click on that link, any of y'all do it now on your computer, it's going to open up this page right here.
So if you want to click on it and then come back to this, she's going to walk you through.
So what I'm going to recommend right now is click on it. All of you guys click on the link right now and then mark it as a favorite. Put that star, put the favorite, and then it'll be in your bookmark on your computer. You can come back to it easy. Okay. So click the link. It'll open this page up on somewhere on the computer, right? And then up here in the upper right, up here, just click the little star. That'll mark it as a favorites, and then it'll be in your bookmarks. Then you don't got to search around for it a lot.
Okay. Yeah.
All right. So did all of you guys click on the link that's in the chat?
Yes, I did.
So somewhere on your computer, whether you're looking at it right now, this one is open. So I need you to come up here and mark the little star. Click the star, and that means it's in your bookmarks, and you ain't never got to fight to get back to it again.
Got it.
Okay. So we got that. So now that you're in there, what we're going to do is, and this just tells you all the stuff I already told you. You're going to click Get Started. and it's going to ask you, well, where do you live? 19720. Okay. Now, what I'm going to recommend right now is, it says here, save time by creating an account or logging in. Go ahead and do that, because when the plans show up, if you really want to see like all the details, you're going to have to log in anyway. So just go on and do it now. Save time. Okay. But if you forget, it'll ask you later. So you put the zip code in. Okay. And you say next. Is this big enough? Do I need to make it a little bigger for you? See if I can make
It's big for us over here.
All good. Okay. All right.
And like I said, you guys don't have to do this right now, but she's walking through, so you'll
I'm
know.
walking you through how easy this is going to be. So, Ann, you're going to have a choice. Apparently, you help them all the time, right?
Yes.
So you can do this entire process yourself and never talk to nobody if you want to be bothered with nobody. Okay.
Okay.
But if you get to any point in time where you got any questions, we're going to phone a friend. Okay. And you're going to pick up the EOS telephone number and you're going to call them. And when you call them in, they're going to be able to see everything that you already did.
Okay.
And you can ask them whatever you want to ask them. And so when you come in here, okay, so when you come in here, you'll have the ability to go as far along this path as you want on your own. But at any point in time, you can call and ask for help. And they'll be able to see what you already did. And if you create an account like I told you to, every time you come back in here, it's going to remember everything you did, so you don't got to start over. So just go ahead and create the account. So it's going to ask you a couple questions. Do you have any upcoming medical procedures you want to make sure are covered? We're getting a knee surgery, so we're going to say yes. Are you on Medicaid or participate in the federal extra help program? Our answer here is no. Do you get annual checkups from your doctor? Yes. Do you see a medical specialist? Yep, that'd be that orthopedist. All right. Which type of medical plan do you prefer? HMO, PPO, or no preference? I'm going to recommend, so you can see all of your choices, pick no preference.
Okay.
Now, we're already on a PPO. Right. If I pick PPO, though, it's only going to show me PPOs, and I will never see what any other options might have been. If I pick HMO, I'm only going to see HMO, and I can't see the PPOs. We want to make sure we see in everything.
Okay.
So pick no preference. And if you don't know the difference between the HMO and the PPO, you click on this link and it'll tell you. Okay, so we're going to say no preference. Okay. Do you travel outside of 50 miles from your primary doctors and hospitals? Like my mom, she lives within 50 miles of where she was born. She don't go nowhere. And we're not going to doctor in California, so we're going to say no. All right. Then you go next.
But in the case of like Mama Dot, she goes up to Duke, which is more than 50 miles away.
Yeah.
So when you do hers, you would say yes.
You would say yes.
Gotcha.
Okay. Because that's when you're starting to make it starts to make that decision. Okay, do you need Med Sup, Med Advantage? It has to do with like networking, what's an in-network and what's out the network. Okay, so 50 miles is not like the hard thing, but that's about the network usually kind of throws a net, right around there. Okay, now we're going to start. Remember on that other page, I said the easy button with those 5 things. Okay, so what prescriptions do you take? It's got some of the most common ones up here, but let's just say you take, let's say my husband, that Farxiga. I don't know how to spell that darn thing. I'm just going to type F-A-R.
F-A-R-X-I-G-A.
And then but look, it came in. I typed 3 letters and it popped in. Oh, there we go. All right. What's your dosage? I click it. Do we take 5 or 10 milligrams? He's on 5 milligrams. Okay. How much is his refill? So we do 90 tablets every 3 months.
Okay.
If you do yours every month, you do 30 tablets every month, because the prices change whether you do it quarterly or monthly, right? Sometimes. So you're going to tell it that. And I'm going to say add. I added that drug. Okay. Now we got another drug. Oh, he got blood pressure. Let's do that lisinopril. Okay. Which lisinopril is taken? This one or this one? We add that one in. Right. We're going to do the same thing. I don't really know what his real thing is. I'm just going to make it up. Okay. Say we do that one every month. So you add in however many medications you need to take.
Okay.
You add them. Okay. You get finished with that. You say, okay, what else is important? Well, we need to know which doctors you want to see. So this is one of the things, if you love your doctors, you're like, look, but if you hate your doctor, we can help you find a new one too. But anyway, it's going to default to a 10-mile radius.
Okay.
But if you need to look a little wider, like we kind of out here in the country, so I'm gonna tell it to, check. So that when we start typing the doctor's name, it'll pop in. Okay. So if I'd have typed in 10 miles and Dr. Papa is outside of 10 miles, he wouldn't have showed up.
Okay.
But there he is. Okay, so that's there. And then, so now we got his name up here. Well, which location? Oh, he's only got one location. Okay. Okay, if I had picked the other Dr. Papa, let's go back here. Okay, and he had more than one location. Right. Say we picked this one. Okay. She's got multiple locations. So I picked the one where I go. We go to this one over in Newark, right? We got a green there. That means that we got her added in. You can add up to 7 doctors in here.
Does that include eye doctor?
I would put the eye doctor and the dentist and the specialist in here too.
Okay.
All right, then we're going to move to the next. What else is important that people don't want to change? Your pharmacy, right?
Yeah.
So this is going to default to a 10-mile radius of the pharmacy. But we always, I don't know about you, but we use more than one pharmacy because like sometimes Walmart has a really good price on this one drug and CVS is better on the other one, right? So it'll let you put up to 3 pharmacies in here.
Okay.
So just pick one. That's the one around the corner from my house. We're picking that one. Okay. Then we go to the next. This is asking what additional services matter the most to you. Now, this is not to say that all of these things might not be in a plan, but we're trying to get the computer to sort based on your priority. So don't pick everything. Pick what's most important. Okay. So I want to make sure that we get the teeth taken care of and the vision taken care of. And let's just say dental vision and that over-the-counter card, they give you that the card that you can use to buy stuff, your incontinence products, your Tylenol, your allergy medicine. Let's just say those 3 things are important, most important to me. If I wear hearing aids, then I kind of need that too. So pick a few,
Yeah, I got that card.
Got it, right?
I got it. Yeah.
Right? Then you go to the next. Then what we're going to do is we're going to rank what's most important to you. So we're going to rank from 1 to 4, 1 being the most important. Which of these is the most important? Out of your pocket, how much money? I don't care what, I ain't changing my doctor, or my drugs better be covered. Which is the most important? We broke the least amount of money. Okay. And then in my husband's case, I hate his doctor, but we got to get that Farxiga drug because his kidneys are failing. So we're going to put prescriptions as the next highest priority besides price.
Okay.
And then, well, I'll switch the doctor if I have to, but, got to get the drugs covered. Okay. And then that puts the 4th one is all the other stuff. Additional benefits. That's over the counter, ride to the doctor. Blah, blah, blah. So you're prioritizing it. And then you come over here and the computer goes.
We found a plan that fits your need.
Boom. Boom. Okay. And it's starting to rank them. So this is showing the 2026 plans over here because that's what's coming up in January. Now this is a little blurry right now because I didn't create it. This is United Healthcare HMO. Okay. Yeah. And this is what we did. The first time we went through, we clicked PPO like you were going to do, Ann. And this plan didn't show. And it basically ended up telling us that the plan he's on right now was the best plan. And then we realized we had to get the knee surgery. I started asking a couple of questions. We came back here and again. And when I picked no preference, the HMO came up as the best plan for him.
Wow.
And guess what? All of the so here, I didn't log in, remember? So this is what happens when you haven't created an account. You can't really see everything right away. Okay. So it's just going to create an account. But let's just say, I want to see the plan details. Okay. It's going to show, you can't really see it here, but from red is bad, green is good. There's a little arrow.
Okay.
Right. But even without logging in, if you click the plan details, you can see the estimated drug cost is based exactly on the drugs that I put in at the dosages that I put in.
Okay.
Out of pocket, right? What it's going to cost out of pocket per month. This is a 0 plan premium. This is the maximum out of pocket. Okay. Medical costs estimated out of pocket, deductibles. So you can see all that, right?
Okay.
So you can click it. So you can click into the details of all of them, but what you really want to do at some point is log in. Okay, so you can see everything that's happening here. And then once you log in, it's going to allow you, there's going to be another box that you can say you have, like, for us, we saw like 10 plans. And so like, let's just compare the top 4. So just like if you're shopping on Amazon, right? You click compare, and then it lines them all up next to each other. Same thing.
Oh, okay.
It does everything for you, right? And so the best one's going to be on the left, and then you can do like my mom is doing. Oh, here's a compare button. Do you see? There's a compare button, right? Say I want to compare these two, right? It's going to start lining them up, and you can see all of the details. Okay, so we don't. This is you got the general gist of it. So basically, create an account, and then you'll be able to see everything right away. And then you can click into the details, which is what my mom is doing, is spending the details in there to figure out, okay, I know the overall out of pocket is less on this one, but I really want to know what's going on with these drugs. So she's clicking under the prescriptions, and it'll give all the details underneath each section of the plan. Okay. So once you decide, hey, I found the one I like, right? You log in. There'll be a button down here to enroll. And you literally go out. It takes you to the carrier website.
Okay.
Without you having to log in or do nothing. It just takes you straight in. And then it's going to ask for the actual details. So you notice up until now, it ain't asked for nothing but the zip code, right?
Right.
Because we're trying to protect all that information. Mm-hmm.
Okay.
So you're not going to have to enter the Medicare number till you actually decide you're going to sign up for something.
Gotcha.
So when you get out on that site, in this case, my husband's like the first name was filled in or whatever. Well, I filled in his name, his address, put his Medicare number in there. Okay. The plan has already been selected.
Okay.
There'll be a couple of options in there where it'll ask you, you could put the doctors back in there again.
Okay.
To check and make sure they're in network. But if you did it in the first step, then you don't got to do it again when you go to enroll.
Okay.
It's just in there in case, say you put 5 doctors in the first time and then you forgot one. So before you sign up, you're like, let me double check and make sure dude is in here, right?
Yeah.
Right. So it'll give you a chance to add or anything, but the stuff that you already did, you literally, there's like 3 screens.
Okay.
And you sign up and you submit it and you're done. Okay. So at any point in time, though, you can pause and say, this is what I'm recommending my mom. Go in there, poke around, be nosy, do what you want to do. And then you're ready to push the last button. Call the EOS person.
Uh-huh.
Talk to the girl. We talked to Wendy, and have them double check and make sure you didn't miss anything.
Okay. Wendy.
Cool.
It just so happened that they got Wendy, and Ree, you could end it with somebody else.
Yeah, I had Wendy.
You can have Bubble.
I got both, right?
And she was just, I got it.
Yeah.
You know
So
you got it.
about this is, see, and you're pretty.
I got it too,
Wendy. Right,
may
you
not talk to
and
Wendy.
everything.
I
right?
got it too.
Yep. There you go. Right. So here, the biggest obstacle is that most of us are like, I don't want to change. And I know y'all just been keeping the same thing for the most part from year to year to year. And for usually that doesn't matter. But this year,
It matters.
it's going to be a lot.
Yeah.
It's going, like I said, that one drug for us was going to go from 47 to 108. I was like, oh, no, we're not doing
Well, at
it.
least
So
it's
the
just
main
108 because I got patients that one drug went from being a $10 copayment to $300 flat out.
So you know what I'm talking about, girl.
Even with the prior authorization, it was still $300.
Exactly. Okay, so that's why I'm trying to just do my part and make sure that nobody's going to get a nasty surprise when they show up at the pharmacy or at the doctor in January.
Yeah.
Okay.
I get a headache every day.
Yeah.
Mhm.
Well, and because she works with patients, probably sees
Yeah.
this. But I think the thing that I hear that's significant, and Ann, you probably missed this, and you'll get the recording. I think one of the benefits to this is that Leah mentioned, and you may notice already, is that anybody who signs up for something during open enrollment, if come January 1, you realize it's not the right one, you can go back and make one change.
Get one more change.
If you don't change anything and try to change after January 1, they will not let you.
Okay.
Yeah.
I got you.
So you can flip flop around, but I recommend here, obviously, when you come in here and you do this, Now you can ignore all the commercials, the TV, the junk mail, because you're done. Just all the advertisements, just let it go. Or if you did decide that you wanted to, right, just come back to EOS and let them help you. Okay. Then you get to the doctor in January, February, and you're like, ooh, this is not what I thought it was going to be. It didn't cover what I thought it was going to cover. You get one more shot between January 1st and March 31st. And if you do want to make another change, don't go to some random, come back to EOS and let them help you find the right one.
Okay.
So this doesn't cost you anything. Like I said, it doesn't. But for you, since you're helping multiple people, you can get through this like that, right?
Okay.
And if you land on the plan, the number one plan over here, and after you look at everything, and I would encourage you, Ann, to look at the details inside, because it's about more than just the out of pocket, right?
Yep.
Okay, so when you look down inside, maybe like what happened with my mother-in-law, her over-the-counter benefit 1 year used to be $30 a month. It went to $30 a quarter. What?
Wow.
Right. That's what I'm saying. So this all the stuff is happening under the covers. It's all happening in the background.
He was getting $30 a month. Then they decided they wanted $30 every 4 months, every 3 months.
Yep.
Yeah.
That's
So
what's
yes,
happening.
instead of 30 a month, now you're only working with basically $10 a month.
Right. Or say some of the plans offer rides to the doctor, right? So
You
if you're
also need to look at lab work.
right, rides to the doctor. So maybe your current plan offers 6 rides a month. That same plan next year may only offer 4 rides a month. Well, if you got to go 6 times, that means you got to take an Uber the other 2. How much is that going to cost you?
Yep.
So that's why you need to go in here and when we prioritize that 1, 2, 3, 4, right, and then you'll be able to go in here and be nosy and poke around, and you ain't got nobody rushing you, and it'll save your progress every time you come back in.
Okay.
So you just got to create a different profile. So just come into the link there, and then for each person, just kind of keep doing it, right?
Gotcha.
So I hope that this has been super helpful. Let me stop this recording. I think we're good at that. Okay.